Welcome. In the next few minutes we're going to look at what actually happens inside the body during yoga practice, and in particular at the role of one nerve, the vagus nerve. A quick word on what this is and isn't. This isn't a wellness claims talk. Everything you'll hear comes from clinical neuroscience and psychophysiology research, and wherever the evidence is indirect, I'll say so. So whether you practice yourself or you work clinically with people who do, this is the mechanism underneath it. First, the anatomy and physiology, because everything that follows depends on understanding this one nerve. Cranial nerve X, the vagus, is the longest of the cranial nerves and the main highway of the parasympathetic nervous system. Let's look at where it actually goes. Before we talk about mechanisms, let's get oriented anatomically. The vagus is a paired nerve, there's a right trunk and a left trunk, and they are not symmetrical in function. Both leave the medulla, exit the skull at the jugular foramen, and travel down the neck beside the carotid artery into the chest and abdomen. The right trunk dominates control of the sinoatrial node. That makes it the main pathway behind what we'll call the vagal brake, and behind the heart rate effects we measure later. The left trunk gives off the recurrent laryngeal nerve at the aortic arch. Hold on to that detail. It's the anatomical reason chanting and humming show up later as a genuine mechanism. This is the pivot from theory to measurement. Older explanations of yoga's calming effect were largely descriptive. Modern work measures vagal activity with non-invasive physiological markers. 2 acronyms and they recur throughout. HRV is heart rate variability, the beat-to-beat variation in the gap between heartbeats. High-frequency HRV is accepted in cardiology and neuroscience as an indicator of cardiac vagal tone. RSA is respiratory sinus arrhythmia, the natural rise and fall of heart rate with the breath. That's the vagal brake, visible in real time within a single breath. How do you read them? With HRV, higher generally means a more responsive vagal brake, but compare a person to their own baseline. Age, fitness and posture all move the absolute numbers. With RSA, look at the size of the swing between inhale and exhale. It widens as breathing slows towards 6 breaths a minute and flattens under stress. One important caveat: both are proxies, not direct nerve recordings. We'll come back to that near the end. The key idea here is direction of traffic. Most people assume the vagus is a top-down control cable. In fact, roughly 4 out of 5 of its fibers run the other way. Afferent fibers carry sensory information from the heart, the lungs and the gut up to the nucleus tractus solitarius in the brainstem. That 80-20 split is why yoga works the way it does. Practice supplies physical and respiratory inputs at the body end of the circuit, and changes the state of the brain from the bottom up. The 20% that runs downward is the vagal brake, slowing heart rate, lowering blood pressure, damping sympathetic arousal. Here's that same idea in one picture. 80% up, 20% down. And the single sentence worth landing is this: yoga is a bottom-up intervention. The body talks to the brain, not the other way round. Everything from here is about how, exactly, the body sends that signal. There are 4 mechanisms and each one gets its own section. 1. Slow, resonant breathing, pranayama at roughly 5 to 6 breaths per minute. 2. Vocalization and humming, chanting, Om and Brahmari breath. 3. Diaphragmatic engagement and movement, asana, trunk rotation, axial extension. 4. Suppression of inflammation through the cholinergic pathway. Worth noting up front, the first 3 are mechanical inputs to the nerve. The 4th is a downstream biochemical consequence. Mechanism 1, and the best evidenced of the 4. Slowing the breath to around 5 to 6 breaths per minute, or using a technique like Ujjayi ocean breath, matches the natural resonance frequency of the cardiovascular system. Here's the physical chain. Rhythmic expansion of the lungs and chest wall activates mechanoreceptors and carotid baroreceptors. That triggers a surge in afferent vagal firing to the brainstem, to the nucleus tractus solitarius. The brain responds by applying the vagal brake. Heart rate drops, sympathetic arousal falls, often within just a few breaths. If you'd like to feel it rather than hear about it, try it as we go. In through the nose for about 5 seconds, out for about 5. This is the anatomy behind mechanism 2. The vagus directly innervates the intrinsic muscles of the larynx and pharynx, via the recurrent laryngeal nerve. In practical terms, the voice box is a mechanical access point to the nerve. Om chanting and Brahmari, B breath, generate real vibration through the neck and chest. And extended humming exhalations maintain airway pressure, which adds to the stimulation. Clinical trials show a shift toward parasympathetic dominance within minutes of vocalized breathwork. So the effect is fast, not only cumulative. Mechanism 2 proper. vocalization and humming. The core claim is simple. Sustained vocalization mechanically vibrates the tissue beds, the vagus innervates, and that vibration increases vagal outflow. OM chanting works. Brahmari works. Simple humming works. And so does singing, which is worth saying because it makes the mechanism feel a lot less exotic. There's a second thing happening too. Vocalizing forces a long exhalation which links straight back to mechanism 1. Mechanism 3, movement in the diaphragm. This is where asana enters the picture. The anatomical hook is that the vagus passes through the esophageal hiatus in the diaphragm on its way to the abdominal organs. So deep diaphragmatic breathing, trunk rotation and gentle axial extension mechanically mobilize those pathways. There's a second route as well. Proprioceptive feedback from working muscles and tendons feeds into the central nervous system, down-regulating cortisol and shifting autonomic balance. To be straight with you, this mechanism is less precisely quantified than the breathing work. The direction is consistent, the dose is less well-defined. This is the strongest single piece of neuroimaging evidence in the whole talk, so it's worth slowing down for. Streeter and colleagues in 2012 used magnetic resonance spectroscopy to measure neurotransmitter levels before and after a single 60-minute yoga posture session. They found a 27% increase in thalamic GABA, the brain's primary inhibitory, calming neurotransmitter. Their interpretation: afferent vagal stimulation during practice raises central GABAergic activity, which is a plausible route to reduced anxiety and improved mood. 1 session. Measurable change. Here are 4 of the key studies. Take a moment to read them, I'll walk across the rows. Streeter is the neuroimaging result we just discussed. Tyagi and Cohen is the breadth argument. 59 studies reviewed and regular practitioners show significantly higher resting vagal tone than controls. Brown and Gerbard covers Sudarshan Kriya breathing, with clinical outcomes in depression and PTSD. And Kitab shows the acute effect, a single 90-minute session raising high-frequency HRV power. Together they cover both sides, chronic adaptation and immediate response. This chart shows the relationship between breathing frequency and heart rate variability. Notice that the curve peaks around 6 breaths per minute. That's the resonance frequency effect from mechanism 1, now shown as data. And the practical takeaway is this: pace matters more than effort. Slower isn't linearly better. There's an optimum and it sits close to 6 breaths a minute. This is a practical walkthrough of diaphragmatic breathing as an anxiety skill. It's the clinical framing of mechanism 3, so if you work with clients or patients, this is something you can teach directly. After this we move into the asana material. These are practical examples of movement that mobilizes the diaphragm and the visceral pathways. Downward and upward dog give you axial extension and a large change in intra-abdominal pressure. Cat-cow cycles spinal flexion and extension with the breath, the clearest example of coupling movement to respiration. The point isn't that these postures are special. It's that breath-linked, rhythmic movement is the ingredient that matters. This chart summarizes the direction of autonomic change measured after practice. At a high level, markers of parasympathetic activity, like high-frequency HRV, go up. Markers of sympathetic arousal and stress hormones come down. Focus on the pattern rather than the precise percentages. It's the consistent direction across every measure that's the real finding. Savasana, corpse pose. It's often treated as an optional cool-down. Physiologically, it's where a lot of the vagal effect actually consolidates. After an intense practice, this is when the rebound into parasympathetic dominance happens. Which is why cutting it short undercuts the autonomic benefit. So here's the practical recommendation: don't skip the final rest. Mechanism 4, and this is where we shift from neural effects to immune ones. High vagal activity triggers the release of acetylcholine. That's the cholinergic anti-inflammatory pathway, first characterized in vagal control of TNF. Acetylcholine binds to receptors on immune cells, macrophages, and blocks the release of pro-inflammatory cytokines such as TNF and IL-6. This is why the effects of practice show up in blood markers, not just in how people report feeling. Arguably, it's the most clinically consequential mechanism of the 4. This is the evidence for the inflammation pathway, plus the breathing dose-response work. Take a moment to read it, I'll highlight 3 rows. Pavlov and Tracy established the cholinergic anti-inflammatory pathway itself, efferent vagal signaling controlling cytokine production. Kiecolt-Glaser found IL-6 was 41% higher in novice practitioners under stress than in experienced ones, which speaks to cumulative adaptation. Yadav and Shetty both show reductions in IL-6 and TNF-alpha with sustained programs. And the last 3 rows answer the dose question. 6 breaths per minute outperforms square breathing and 4-7-8, and slow breathing beat fast breathing for vagally mediated HRV. Now the honest caveats, because credibility depends on them. First limitation: we can't place electrodes on a living human vagus nerve without surgery. So every figure in this talk rests on proxies. High-frequency HRV and RSA are well-accepted indicators of cardiac vagal tone, but they are indicators, not the nerve itself. Second, not all yoga is equal. Heated, high-intensity flows raise sympathetic arousal during the effort, with the vagal shift arriving afterwards. Slow, breath-centric, restorative practice engages vagal tone throughout. If you're skeptical about any of this, this is the right place to push. Let's come back to the central argument. Breath rate, vocal vibration and diaphragmatic movement are physical inputs to a physical circuit. This is mechanism, not metaphor. Their effects are measurable, in HRV and RSA, and downstream in circulating markers of inflammation. And keep the 2 caveats with you so you leave with a calibrated view. The measurement is indirect and the dose depends on the practice. For vagal tone specifically, slow and restorative beats fast and heated. Thanks for watching.